We have a successful low back pain case using Bisoma Acupuncture. This patient is male, age 42. He does restaurant supply sales, which means is that he sells supplies for restaurants, and therefore he lifts and packages and puts things in, and it's a labor intensive work throughout the day. And he also delivers them by driving those restaurant supplies. He has had bulging discs since age 20s. He's all his life he was quite active and also did much athletic activities such as football, basketball, soccer, swimming, and so on. So he had this chronic low back pain, and he was able to manage them pretty okay until 2 weeks ago or 2 weeks prior, when he emptied out a swimming pool, and then the day after he reached forward to grab an object and his back froze on him. Since then, he had to be bedridden majority of the times. He did go to work, which was 1 hour drive one way back and forth. And so by the time he got there, he had to spend about half an hour stretching, and that only helped him a little bit. And he worked throughout the day. The back pain got worse by the end of the day, even with light duties. Came home with that 1 hour drive, and he had to stretch again and repeat the process over and over. He took medication, he did therapies, and they were not that helpful, so he wanted to try acupuncture for the first time. So I gave him acupuncture, the horary points of gallbladder 44, which is wood, small intestine 2, that's a fire point, stomach 43 is an earth point, LI5 is a metal point, stomach 36 is a water point. I use stomach 36 instead of UB40. UB40 is water point or a water channel. Those are the alternate horary points. But on the first and second day, I gave him the traditional horary points of LI1, UB66, gallbladder 41, small intestine 5, and stomach 36, which are metal, water, wood, fire, earth, respectively. After the first treatment of those traditional horary points, there was no relief. After the second one, no relief. So on the third visit, I changed to the new horary points, which are gallbladder 44, small intestine 2, stomach 43, LI5, and stomach 36. He noticed a little bit of a relief, but he wasn't sure if it was because he was resting over the weekend or because acupuncture was helpful. And then when I repeated the new horary points on the fourth day, it was additionally better. On the fifth visit, it was even better. So he was improving with those 3 visits in less intensity, less frequency, and shorter in duration, indicating that the condition is improving. After the 5th visit, he had an x-ray which showed severe arthritis in his lumbar. In spite of that, he was still improving. After the 6th visit, it was even better. And after the 8th visit, even better. So after the 8th visit, he was at around 80 to 90% relief. After the 5th visit, he was at around 60 to 70% relief. After the 5th visit, he did go to an all-day event where he sat, he walked, and he stood. And yes, it did aggravate his low back pain, but not so much. And by the next day, it was even better than the previous day. So there was a progressive linear improvement in intensity, frequency, and duration. Although he had severe lumbar structural issue, he in spite of that, he still improved because he was reactive to acupuncture. Some people with same condition are more reactive than other people are. And so that individual difference in reactivity counts a lot. In addition, acupuncture points are important. Getting the optimal points for them is relevant for their significant relief. So in this case, the relevant horary points or relevant optimal points happen to be the alternate horary points. He will still need to continue acupuncture on a regular basis every 2 to 4 weeks to maintain his improved state, because it can be easily aggravated given the type of work he does and given the situation, the structural situation he has. But it would help to prevent the problem than otherwise would be, and he could also have a regular quality of daily living with regular Bisoma acupuncture. So once we discover what points are good for him, just continuance of less frequency would help him to be stable over time.